Please. No, there is nothing called. Huh? The reason for that is the basic nature of cancer is an unregulated cell growth. So our body has a regulated cell growth. So from one cell we take this form today, and that is all planned. There are certain genes which work in a certain way. One gene knows how to develop bones, one gene knows how to develop the nervous system. So that's a planned cell growth. And there is apoptosis. Apoptosis means planned cell kill. Because if the old cells do not die, the new cells don't come in place. So you need to create, like as I was saying, that after a certain period of time I need to move from my practice and take the role of a mentor to create place for new generation doctors. So that is also for our body cells. The old cells has to move back and they have to die automatically so that the new cells come up. So this is what is called planned growth and planned apoptosis or planned death of cells. Cancer is unplanned growth. So something triggers, which can be cigarette smoking, which can be alcohol, which can be industrial pollution, which can be ionizing radiation. Obesity, yes, obesity is related to cancer. If you are more obese, you are more prone to get cancer. I would come to the specifics at the end of my talk, because then I would lose track and I would end up nowhere. So that specifics I'll come later on. You can interrupt, but interrupt me intelligently. So the next thing is, so as I was talking, so cancer basically is unplanned growth of cell. And when unplanned growth occurs, it occurs at a much faster rate than a normal normal cell growth. That's why you see lumps and bumps. Because if it is unplanned growth, there is no room for that cell to grow. So it grows at the cost of a normal cell. So your normal cell dies and it creates room. So in a breast, you would see a normal breast won't have lumps. But if it is a cancerous growth, it will grow into a lump and the breast will get disfigured. If you have a tongue cancer, it will be an ulceration growth and the tongue will disfigure at the cost of normal cells. So that's what happens in cancer. So when that happens, there are a lot of neovascularization. Neovascularization in simple terms means new blood vessel formulation. Now our cells derive nutrition from blood vessels, blood. Because whatever we eat, the nutrients get dissolved in the blood and it circulates into every nook and corner of the body and supplies nutrients to the cell. So that is what the vascular system deals with. Now when a cancer cell's growth, the demand is more because it is growing at a much faster rate. So what it will do, you are not eating more, you are eating the same thing. So your nutrients, instead of going to your normal cells, a major portion of it will go to the cancer cells. How it will go? Because it will develop its own new blood vessels. And what will happen? The lump will grow and you will shrink in size. So that's why you get weight loss in cancer. Because you develop weight loss, you get thinner, you get weak. Because your normal tissues are not getting the nutrition they deserve, whereas that has been taken up by the cancer. So that's how it, and while doing so, when new blood vessels grow, the cancer cells gets themselves dislodged from the tumor and go into the blood vessels. And once it goes into the bloodstream, there are no boundaries for it. It can go anywhere in the body. And that's why cancer is so dangerous, because you may have a tongue cancer, but that cancer cells go and settle in your liver, and there is a second cancer developing in your liver, or it goes into your lung. That is what we call metastasis. That is when it becomes a stage 4 cancer. So every cancer is potentially life-threatening because it has the propensity to travel through your bloodstream and settle anywhere in your body. And that is the reason why we always say that cancer, if detected early, because detected early means at the very earliest stage when this propensity of traversing through the blood vessels is not there. So when the cancer is small, then they tend to look locally at their growth. They are not looking at other sites. When they grow in size, then they don't have room for increasing any further. That's the time when they start migrating here and there. So if you can get rid of a cancer early in its life, then you actually can stop, or the probability of making it not to traverse anywhere else is very high. So that's why cancer becomes such an important disease, because a cancer developing in one part of the body can affect other parts of the body, which is not happening in any other diseases. So that's why cancer is so important. So cancer, the other myths which are there is cancer is caused by injury such as bump or bruise. It is not so. It is only, sometimes coincidentally you realize that you suddenly, while playing football, you get a trauma. You get a pain, and you suddenly feel something and you feel a bump. You correlate it to the trauma, but the trauma is an incident which has got your attention to that. So it is not that. Then cancer always runs in the family. It's not so. If I have got family members in my cancer, my father had cancer, my grandfather had cancer, that doesn't mean that I will also have cancer. 15% of all cancers are usually familial. Familial means when you carry a gene subsequently in families and you can develop cancer. Not all cancers, there are certain cancers like prostate cancer, colon cancer, breast cancer, ovarian cancer, which are essentially familial. But 15% of them, it doesn't mean that somebody has a breast cancer means her daughter is going to also have a breast cancer. It can only happen if she carries that high risk gene, and that gene is BRCA1 and 2. There's so much hype with Angelina Jolie. BRCA1 and 2. So those are the two genes which are, and that's why Angelina got her mastectomy done and the ovarian, because she runs a very high risk of developing breast and ovarian cancer, because she carries the BRCA1 and 2 gene. So there are certain genes like that which actually are familial, and there the cancer runs in the family. Rest are all sporadic cancer. But there is a genetic influence. And what is that genetic influence? There is a somatic change in the gene, that is, the gene undergoes mutation. But that is not transmitted from generation to generation. It is a somatic mutation which develops in yourself and you develop a cancer. So that's something different. So when we order a gene test for a cancer patient, that doesn't mean that we are testing that gene to look into whether he is predisposed or his family members are predisposed to develop cancer. We are essentially looking at the genetic mutation he or she is having, so that we can modify our treatment accordingly, because now the science has progressed so much that you can actually alter the genes and use antibody to that genes and treat those patients, which is called targeted therapy, which I will come later on in my talk. But there are other genes to be ascertained, which are familial genes, to know whether the genes run in the family, so that you can make use of more effective tool for cancer screening for the rest of the family members. So that's where that gene test is more important. Cancer may spread after having a biopsy or surgery. I think the biggest myth, and that has to be borne in mind. You see, I tell my patients, sometimes the patient tells me, डॉक्टर साहब बायोप्सी करवाएंगे तो फैल जाएगा बीमारी। आलम जी, अगर ऐसा ही होता तो कैंसर किताब से बायोप्सी शब्द निकाल देता। Then the biopsy word should not have been there in our text. It should have been removed, because there is nothing in the text which is harmful to mankind. It is all meant to cure patients and treat them. Biopsy is the integral and essential part of treating cancer. Because why biopsy is so important? Because without biopsy,